Now we're going to look at the other muscles that help you breathe. The diaphragm is assisted primarily by the intercostal muscles. Inter equals between and costal equals ribs. They're located between the ribs. So when we eat ribs, we're eating a pig's intercostal muscle. There are internal and external intercostal muscles. They elevate the ribs, increasing the volume of the lungs, which are attached to the inside of the ribs. This helps to increase the lung capacity. So how do we feel the effects of the intercostal muscles in breathing? To feel the movement of the ribs in breathing, we want to sit tall and close your eyes. Stack your ribs over your pelvis and place your hands under the opposite armpits so that your fingers wrap around your rib cage. Send the breath more into your hands. As you inhale, feel the expansion of the ribs lifting wide into your hands. As you exhale, exhale completely and stay relaxed through the throat and use your hands to gently compress the ribs. As you inhale, let the ribs spring back open. And note, we often lose some springiness in our ribs through poor posture or incomplete breathing. This is a quick way to regain the buoyancy. Try several breaths and see if you can balance the movement so that it is equal in both sides. Here we have the accessory muscles. So there are many muscles attached to the rib cage. Any muscles that attach to the rib cage can affect its shape and therefore have some effect on the breath. They are fine tuners. They do not do any heavy lifting in breathing unless there's a problem. But dysfunction in the muscles can affect the breathing. So in the video, it's a nice overview of some of the accessory muscles. Watch at 6 minutes and 47 seconds. It should start there automatically, and then until the end, which is about 4 minutes long. Pay attention to the scalenes, the sternocleidomastoid, or the SCM. Any muscle that attaches to the rib cage, the Pectoralis Minor, the Pectoralis Major, the Serratus Anterior, and the erector spinae. When you get through, you can palpate some accessory muscles. And when we palpate accessory muscles, let's look first at the scalenes. Those are the muscles that run along the side of the neck and into the hollow of the collarbone. Palpate by sticking fingers into the collarbone hollow at the base of the neck. The muscles feel long and thin and ropey. It will feel like you're strumming a guitar string. When you tilt your head to one side, you're stretching your scalenes. With the SCM, from the mastoid process in the jaw to the top of your sternum, long muscles that stand out when you turn your head. Massage the sides of your neck, like pulling the ruff of a dog to feel it. The muscles that pop out at the SCM junction when you fully turn your head, tilt your chin forward and up to feel its stretch. Then we can look at the Pectoralis Major and Minor. This is a review from Anatomy of the Shoulder. This runs from the sternum to the upper arm. Palpate from the sternum to the chest laterally. The Pectoralis Minor has located just inferior to the acromion process of the scapula, and it's often quite sore. In the video, the muscles in motion, it comes from what muscles are used for forced inspiration breathing. I will list the YouTube videos in the review section for you to watch. What is the difference between the chest and the belly breathing? So is there any kind of breathing that does not include a diaphragm? No, all breathing involves the contraction of the diaphragm. So why might I feel the breath in my belly versus my ribs? When the abdominals are relaxed, the water balloon is free to expand out when pushed from above. When the abdominals are engaged, the diaphragm is more restricted in its ascent. So instead of dropping down, the diaphragm instead will lift the ribs, which will result in a chest breath. So what is a forced exhale? When we use the abdominals to really encourage the exhalation, this is called a forced exhale. I'm pushing the water balloon up into the accordion to push the air out more rapidly. We have finished anatomy of the breath. In the Google Classroom, you will find questions and answers and all of the assignments that you can try at home and do the palpation yourself. Also, watch all of the videos that may not have shown up in the slides. I will put all of those videos, if they didn't show up in the slides, in the review section.